Please hold your passcode. Your pass confirmed. Please enter your personal identification number or PIN, followed by the pound or hash key. When you hear, you be the 21st person to join the meeting.
Why don't you tell me when we're ready, and I'll go ahead. Oh, Corey, the recording started. Okay, we're going to need to mute a few more lines here to get going. So, hello, everybody. We're ready to start. I've got some background noise there, so let's be sure we've got everybody on mute. And *6. Does the muting. Okay, that's better for the background. Well, welcome to this session, and it looks like we have everybody here. I'm glad to see that some of you are in group together, and I'll give you a little more information about that in just a second. And Cindy Reese is here with us to be our guest speaker, and she's got the ball for advancing the slides. I'm going to introduce her in a minute, but Cindy, can you give us the next slide here? There you go. Okay, thanks. And as you guys know, we're going to talk about the use of unfolding case studies, and we're going to do one here. We've got the scholars have done a nice job of volunteering to help us here. So the one thing I want to kind of point out is I have always felt that we've probably role modeled the lecture strategy pretty darn well. But, there's some downsides to doing that. So these last 3 or 4 sessions, particularly as we give a good lunch and send off to the scholars who are graduating, I wanted to be sure that you all had a sense of some more active learning strategies that you can use in the classroom. So we're going to do the unfolding case study. And then when we're together in April, face-to-face, we're going to talk about SIMS and do a high-fidelity simulation. And then we're going to also talk about team-based learning. So these are some ways that you can get more active learning going. And I kind of want to remind you about the 7 principles of good education, that anytime we're working with the students, we want to be sure that we keep them engaged, that we give them feedback, that we have a chance for them to work together, collaborate, and that we have respect for diverse ways of learning. So you guys go review those 7 principles, and every time we're in a teaching learning situation, we want to be sure to engage in those. So the emphasis today is on a classroom teaching strategy, unfolding case study, and I just read an interesting article in the Journal of Nursing Education that says these lower fidelity kinds of simulations, and an unfolding case study really is a sim, are as effective as those high fidelity money with the human patient simulators. So these strategies that we're going to be talking about over the next month or two really perk up the students and perk up learning, and so that's why we're spending so much time for these next 3 big sessions talking about this. Cindy, give me the next slide, and then I'm going to introduce you here in a minute. Just as a reminder, we all the lines muted. Now, the panelists, the 7 of us, are live for the moment. But when you want to participate, raise your hand. And I think everybody knows how to do that. And if you need to practice, go ahead. But then remember to put it back down. I know that some of you are working together, so if one of the people who huddle around a computer, if you want to a question or participate, just have whoever's controlling your end of it raise their hand, and we'll call on you, and then we'll get the right person to participate. So the reminders. And then, Cindy, give me the next slide. And here's our overview, and you guys received this too as, some of the other handouts I distributed to you. But we're going to talk about, the case studies and how to use them in the different ways. And we are going to do a case study, an unfolding case study here. This will be one of the first webinars. We're trying to make this really interactive, so we're excited about giving this a little bell here. So that's the game, and we're going to be line at least from 1 to 3. We're doing a longer time in this session, and then for those of you that would like to work on drafting a case study, because Cindy's going to show you, the design steps, I'm going to stay on with you, for an hour, whatever it takes, so that we can, if you want to get a case study started, I'll be glad to, work with you and give you some feedback. And because of this collaborative learning community, it just seems like we have a lot of opportunity for sharing, and it takes a while to get a good case study going. Cindy can tell you that because she designed the one we're going to use here. And once they're developed, they can, be shared. So I'm hoping that some of you will be inspired to do that. Okay, moving on here. Introduce you to Cindy, and Cindy is fabulous. She's a certified nurse educator. We've, I try to hype that to you, and she's a recent PhD grad, and she's the Associate Dean at Lincoln Land Community College in Springfield. And we're talking, Cindy, about the various roles that educators, nurse faculty have, and you're
right.
Certainly an educator, a great teacher, and administrator. Did you have that administrative position before you received your doctoral degree?
No, I did not. I had been faculty all the way up until then. I got my PhD in March and took an administrative position in November of that same year.
Okay. Well, see, this is an inspiration to our doctoral students, and the doctoral students at Rutgers are taking their qualifying exams. I'm sure you can remember that. So they're busy.
Absolutely.
Writing. So anyway, Cindy's part of her role is teaching and administrating. And, she's also a researcher, and her doctoral research was about simulations. And I know you developed an instrument. What tell us about that a little bit.
I developed an instrument to measure effective teaching behaviors in clinical simulations. There weren't any instruments out there really focused on that. So it's basically a Likert scale type of an instrument where students will complete that after the simulation and debriefing, and it gives the instructor feedback for how the students felt that the instructor did during the simulation. So it gives them feedback, hopefully constructive, that they can use to improve their teaching in simulation. And I do have something really exciting to share about my instrument, is that they're looking at it to be included in the new national or CSBN study on simulation. That's going on. So I'm really hopeful that they'll find it useful and be able to use it. So that's very exciting for me.
Okay.
And to actually see all that work go to fruition. So
sure, and that's exactly what we want every doctoral students and master students when they're doing, thesis and dissertation work to get that out there. And of course, we're going to see this in university education sometime soon too, aren't we?
Yes, that's my little rough patch, is getting the manuscript together.
Okay, but I'm glad it's going to be in use. And then she also, she's really did a great job of getting her career launched. And one of the areas of her service is working with the National League for Nursing. And as many of you know, that they have a grant from the Hartford Foundation to develop some unfolding case studies around the area of gerontology. And Cindy is working on the case study that we're going to do today, and she'll tell you a bit more about it, is what she has done. So Cindy, we love you for all that you've accomplished in this short time since you've graduated. So, and some of you probably met Cindy because she's also on the lecture Circuit has presented a national technology meeting. So you guys are in for a real treat here to be able to meet Cindy. And if you come to the National League for Nursing Summit, you will introduce yourself to her, because I'm sure you're
Right. I'm actually going to be presenting about my instrument and about the unfolding case studies as well. So it's going to be a busy summit.
Yeah, good. Well, that's great. I think we're ready to have you get going, so
Okay,
I'll stop talking.
Okay. Hi, everyone. I'm really glad to have this opportunity to come and meet all of you virtually. This is the first time I'm doing a webinar, so this is another new adventure for me. But I just want to share with you a little bit about what are unfolding case studies, give you a little bit of a background, and then, of course, we'll be doing the role play on the webinar. And then lastly, I'll talk with you about how we will, or give you some hints and talk with you about how to develop unfolding case studies yourselves. That's been something that I've recently learned with my NLN work, how to develop the case studies, and I've got hopefully some helpful hints to share. So just some background here, unfolding cases, Glendon and Ulrich in 2001 wrote give a classic text on what is an unfolding case study, and their definition is that it's an adaptation of a traditional case to allow application of knowledge, skills, and attitudes required of them, which would be a student, in a clinical setting that will simulate a real-world event. So that's the big plus there is we're simulating the real-world event rather than looking at what they read in the textbook that isn't always so meaningful for them. It's also very interactive, as we'll see modeled when we do the role play. Unfolding case studies can be written, pencil and paper. They can also be simulations from low, medium to the high fidelity simulation. They can be role play as well. And they're really great to foster the clinical reasoning in the students that we're all after. Plus is that you can structure unfolding case studies so that they're realistic and that they contain ill-structured problems and missing information. So the students presented with not all the information's there. It doesn't necessarily fit what they've read in the textbook. So they really have to think from the outset, how am I going to get through this? What information do I need? What resources do I need to pull in? What other disciplines do I need to consult with to help the student or patient? It also can be structured to integrate your national standards such as QSIN, IOM guidelines. We base these case studies since we had gotten that grant. There was a group of gerontology experts also working with the N that developed what's called the ACEs framework, and we've got a set of essential nursing actions that flow from the ACEs framework, and we used those to develop our case studies around to make sure that we were hitting all of those essential nursing actions. They're very flexible in that you can fit them anywhere into the curriculum. I've talked to people that have used an unfolding case study over a day-long session day or a semester-long, and I also recently talked to someone who had actually used an unfolding case. A family was introduced at the beginning of their nursing program, and they dealt with the same family and their problems throughout the curriculum. And again, I think I've already mentioned this, it's very flexible. It can pretty much mold to whatever you want it to do, last as long as you'd like. So they're really fun to deal with. You kind of get to use your creative side as a teacher. Some other points, how unfolding case evolves is going to be unpredictable to the learner. The instructor should have kind of an idea of where they want it to go, but that information shouldn't be real clear to the learner. We want them to have to reason and think through this. We give them new situations and add things with each encounter. For example, with Millie, the case study we'll talk about here shortly, on And the second and third scenarios, the second scenario, we have a fall risk. She's had a near fall. That's a new element that was added in. The last simulation, getting sent home, and her family's worried about safety at home, so we have to worry about those types of issues. And the third point there, it pulls in storytelling and the experiential nature of simulation, so it's kind of it is positive on more than one front. So it allows the instructor to be creative, but with a storytelling feature that we'll talk about, allows your students to be creative as well, and provide continuity of care, which we know a lot of students don't get with the nature of their clinical experience. So it can follow a patient, follow a family for an extended period of time. Ideas for using simulation with unfolding cases. First bullet point there, bringing simulation into the classroom. I really need to think about how we can use that expensive simulation equipment somewhere else than just in the sim lab. And if you can get your SimMan or VitalSim, whatever you're using, on stretcher and bring them in the classroom, why not do a simulation in front of the group, just like what we're going to do today? Brings in that interactive teaching role as well. If you don't have a simulator, want to do it very low fidelity, which is what we're doing today, role play works great. And students seem to be fairly willing to role play. I think if you introduce it into a program as they get used to doing role play and have that incorporated in the learning strategies, then that increases their comfort level and their desire to participate. Also, videotape simulation, they can access it online if it's an online program. That could be done either in real time or it could be taped. A reason why we couldn't have a simulation going on in Sim Lab and have it being videoed into the classroom. You use it, like I had, over a day or a term or a program, any length of time that would fit with your needs. Plan a simulation day with varied stations, have the unfolding case study, but then also have some motor skills practice. You can have some things on the web for them to do during the day. And the big thing with these is you can modify the complexity. What we'll show you today is our scenario, very low complexity, and talk about maybe how we could make that simulation more complex for possibly a higher level student. We could integrate more problems. We could have them do more psychomotor skills and things like that. Otherwise, I always solicit, are there any other ideas that anyone could think of for using an unfolding case in their classroom? And if you have an idea, I'd love for you to raise your hand and share.
So we'll just take a little minute to give people a chance to think of some other ideas. Cindy, one thing that came to mind, because I work a lot in this distant virtual environment. I have heard that some people are doing unfolding case studies in Second Life, particularly in the area of psych nursing, so that the students get a chance of kind of practicing doing interviewing with a psych patient and doing kind of a role play there. So I don't know if everybody knows what Second Life is, but it's kind of a virtual world. You go online and you have an avatar and are interacting. So I think that's a possibility.
Absolutely, and I think that we're going to be hearing much more about Second Life and virtual communities as far as simulation in the near future. I recently met someone who was offering to try to get Millie into Second Life, could be presented here, but we just didn't get that far. We wanted to try the role play first. Yeah. So that there's a lot of interesting things that could be done, and anything that you could think of. I mean, there's nothing that's wrong with this. There's no way to really do it wrong, just so you've thought it out and planned it out ahead of time. So.
Great. Well, everybody's cool at the moment, so we can move
Okay.
ahead. Okay.
Now I'm going to give you just a little bit about this geriatric unfolding case, because my case obviously is geriatric focused. And one thing I want to let you know is that I really have not a level education in geriatrics. So what we did was we brought geriatric specialists together with simulation specialists and came up with the unfolding cases. So that was kind of a good collaboration, and I don't know, if you're an expert in a certain area, you might be willing to lend your content expertise with someone that has more expertise in simulation or vice versa, and have a collaborative. It's been a lot of fun to work together. Each of the geriatric unfolding cases, you can see here what we've included. We've included complexity, missing information, so the student would have to look for additional resources, various settings. We have a family issue in each. And then lastly, we focused on common geriatric syndromes such as incontinence, sleep problems, and those sorts of things. And that this is focused on is differences in responses of older adults to illness. So that was something that the gerontologist felt that we needed to highlight. That's built into Millie. Also assessing risk to benefit and keeping in respect for the geriatric person's preference and values. What we mean by that is we won't be doing the second scenario of Millie or the third. Millie has a fall, as I mentioned before, and the family, Millie, and the nurse have to go through figuring out, are the risks of sending Millie home worth it, because Millie so desperately wants to go home. She doesn't want to go to extended care. So is it worth the risk? We're using evidence-based practice through the use of validated tools to assess our geriatric patients, and we also use a multi- or interdisciplinary team approach. Okay, so I think what the best thing to do is just get right into the role play here. And part of the way these case studies are set up is that there's a first-person monologue that has been recorded for Millie that introduces the students to Millie, and that's accessible to the student prior to participating in the simulation. And it's a little bit different than saying, it's 84-year-old widow with these symptoms. What this is a 4 to 5 minute monologue that really introduces the student to Millie. So we'll go ahead and them cue up and play monologue.
Millie, I have lived in the same small house for the last 50 years. Harold and I raised our dear daughter Dina here and had many good years together as a family. He passed last year. He was 91, I miss him terribly. I think about him every day. We married for 68 years. Most of them were happy. Struggled with money at times, but who didn't? All our family lived close by and spent many a Sunday cooking for 15 or 20 after church. Our home was always full of people. Many of them are gone now. Snuggles, my cat, keeps me company. Snuggles is about 10 years old. She's Dre, who just showed on my doorstep one day, and she's been here ever since. I've always kept myself busy. I sing when I can in the church choir. I volunteer in the church kitchen. I still love to cook. This is always asking me to make my famous chicken and dumplings when we have special dinners. I can't do as much as I used to, but that's okay. I am fortunate to have many close friends from church. I also enjoy gardening and known for growing my prize roses. Rodent is not quite as big as it used to be, but I still like to get outside and work with the soil and the flowers. Fresh air does me some good. There are enough roses to cut several large bouquets every summer, and share them with my daughter and my friends. Do you know that my roses used to win blue ribbons at the county fair almost every year? Since Oldest is gone, I go over to my daughter Dina's house every week to visit and see my grandkids. Dina's a good cook, but her dumplings aren't quite as good as mine, and I try to make a batch to take with me when I can. Dina works every day at the school, so she's busy most of the time. She is a good daughter, and she helps me when I need to get to the doctor. She also picks up groceries for me once in a while. I have 3 grandchildren. Jessica is 17, and she graduates from high school this year. Neil is 14, and he's a handful. He can give his mother trouble about getting his homework done, and I don't think his grades are very good. I know Dina worries about him. Meg's 12, and she is such a sweet child. She helped me with my roses in the summer. I went to the doctor last week to get my blood pressure and my cholesterol checked. He wants to start me on a new pill for cholesterol. I already take about 6 or 8 pills every day. Oh dear, I hope this new pill isn't too expensive. I already have to pay a lot for my medications, and I don't get the pension anymore since Harold died. I don't know how Harold paid all the bills. It doesn't really seem like there's enough money for all that medicine. Lucky that I can still get around pretty well, and my house is not too big. Mine are pretty bad. I think they're just worn out, and they hurt a lot. But I'm thankful that I can still tend my roses. Mother isn't as good as it used to be. I have to use Depends now, and I worry that someone will notice the odor. I can't laugh anymore. The leakage is getting so bad. But things like that happen when you get to be as old as I am. I can't complain.
Oh, that was Millie. So we're very proud to have had an actress be able to record Millie, and we tried to record her in a voice that was generic enough that Millie could be any one of these people on the slide. So she could be any race. And what I want to show you in the bottom right slide is Millie at the NLN Summit last year. Laird had a mannequin dressed as Millie here, and you can see her there. But we really wanted to make it generic so that you could fit Millie to whatever you needed for your curriculum and in your area. Next, we prompt the students with a set of discussion questions, and you recognize these from Patricia Benner's book, Educating Nurses, A Call for Radical Transformation. These questions were adapted from there as they were recommendations for how to get your students to be thinking about patient problems. So we've got a set of discussion questions here that we're going to go through and see if we can come up with the answers. So the first thing that we do is have them identify what are Millie's strengths.
So, Cindy, do you want to just open this up for people to answer or respond here in terms of?
Absolutely.
Yeah. Okay,
Yeah,
so,
the more interaction we can get, I think, the better.
so just raise your hand, and we'll need you to then unmute yourself, which is the *6. And I see Cindy. I can at least hear getting people called on, and I see Tammy Cooper has raised her hand. So, Tammy, do you want to go and give us a talk here?
As far as restraints, can you hear me?
Sure.
Hello, can you hear me?
Yes,
Yes,
we do.
Yes, we can hear you.
Oh, as far as restraints, I think a lot of them, well, two of them I can think from the story are the gardening she enjoys and her grandchildren or family, so she has a good support system.
Absolutely.
Okay. And did anybody else other strengths? I see Christine Brewer and Tammy, be sure to unmute. But Christine, and I know you're representing the FDU folks, so we'll call on you and unmute yourself there, *6. So, Christine or FDU, you have to do *6 to get unmuted.
Now?
Yeah, we hear you.
Hi, it's Erin Gralick from FDU under Christine's name.
Okay.
Another one of Millie's strengths is that she has a lot of family living close by, so she has the support system of people who know her, and also her church group. She's very involved in that. That's
Then if you put yourself back on mute, *6, and then I see
okay.
Mahoney. Do you want to go ahead? And Jan, you're there with some other scholars, so
Hello.
yeah.
Okay, this is Janet Mahoney from Monmouth University. I have a whole group of people in my office. We said that the church group is another support for this person.
Absolutely.
Volunteering as she volunteers and she also sings.
Right.
So those are all strengths.
Okay.
So should we go ahead and move on to what are your concerns about Millie then, based on what you heard in the monologue?
Financial.
Want me to raise my hand again?
Okay. I think the people at Monmouth are still online, so do you want to go ahead while you're there? Jan, your gang? Yeah. Yeah.
We're having trouble with the phone here. Some of her concerns be the finances to pay for medications. So concerned about her urinary incontinence with the her cholesterol level, and safety in the home because her knees are bad. Anything else, group?
Living alone.
Oh, yes, that's good. That's good.
I didn't hear that one.
Oh, living by herself.
Oh, okay.
Oh, because somebody else has their hand raised, and I'll Janet, see if you can do the *6 and unmute yourself. And I'm going to call on Mary Ann Wilson next. And McDermott, I did see your hand raised, but I bet we covered one of the points you wanted to say. If not, raise it again. But Mary Ann Wilson, go ahead.
This is Minsky. I raised Mary Ann's hand. Office with me. She doesn't really have anything to say, and they kind of covered it. Actually, it's a strength and weakness is the because to cat obviously can cause fall, but it is company, and it's good for her blood pressure, but she also has to have the money to pay for the cat food. So it can make pets complicated.
Okay, great. Thank you. And Marion McDermott, your hand's back up, so we'll call on you, and *6 to unmute if you need to.
I'm not an advocate.
Me neither.
I'll let you hold my first.
Oh,
So,
Diane,
yeah.
can you hear me?
Yes. Yes, Diane.
Yeah,
Yeah, go ahead.
been on and thrown off about 3 different times, so I have no idea. I kind of feel like I'm in no man's land. And I don't see an X, so I don't know if that means I'm not here, so I apologize.
Oh,
I'll unmute myself and
okay.
and
But now that you can raise your hand and participate, and that we hear you and you hear us, so you're good. Okay.
*6 to mute and unmute.
That's right.
Thank you very much. I'm sorry.
You're very welcome.
Bye-bye.
Okay, looks like anything else that want the students to suggest here?
Really, I think that they hit all of the major points there that I had. It looks like we've had Robert put his hand up a couple of times.
Okay, go ahead, Bob. Thanks, Cindy. I didn't see that.
Sorry, I don't mean to keep putting my hand up and down. For some reason, it was getting stuck. The only thing I had to add is that if Millie actually knows how to finance, her husband did it for 68 years.
That's exactly right. So that'll come in with the 4th question. What information do you need? We're going to need to find out what she does know how to do. That's a good point.
Thank you.
Okay. Cause of concern. Why should we be concerned? I think we've mentioned a few of these things. But why would the concerns cause worry? I've got an example of she takes a lot of medications. You know, what happens with all the medications she's taking? There might be a drug interaction. It can be difficult to take her medicines properly. And then financial concerns. You know, can she afford her medications? You know, worry about pressure medicine increasing her risk for falls. Question 4, what information do you need then? What information do we need to find out about Millie before we could really take care of her?
So, Dr. Kaminsky or Man Wilson.
I think there's a lot we need to hear to know about her. Robert was right that we really know she understands. She implied that her husband did take care of bills, and we're not sure she knows how to manage that. In there it says that somebody's occasionally or up once in a while picking up groceries.
Right.
I don't know if that's strict. Taking care of really cleaning the house. A woman with babies in this age probably can't do a really thorough job. So is that happening? Is it beginning to deteriorate? What about home repairs? All of that home stuff. You know, heat and delivery, all of that, the utilities. Be worried, but I also want to know about her diagnoses. What are those 8 meds she's taking and why? And how often does she have to see the doctor? Does she need to have regular visits?
Okay. And what about her medications when we get into the first scenario? Let's just go ahead and go to the last question and sum it up. What do we think that Millie is experiencing? I think we mentioned most of these, but to kind of sum up.
And looks like Tammy has raised her hand again. So Tammy, do you want to *6 and unmute and talk to us?
She's experiencing ego integrity versus despair. She's pretty much got older. Everyone's dying around her. She has a limited amount of friends. She does have the church and the support of her family, but she's at that stage in her life now where she just doesn't see too much happening.
That's a good point. And we don't really know. We don't really know for sure where she's at with her developmental stage there until we talk to her a bit. Exactly. And I think financial problems and the incontinence issues, pain in the knees, things like that, I think we pretty much talked about as we went through the questions. I hope the exercise of going through these questions helps you to see that having some structure to helping the students think about what's going on here can very quickly get them to think where we want them to think and go where they need to go before we start the scenario.
Sounds like we need to be sure that everybody's line is muted, particularly in where there's several of you working together, because we can hear some talking. So be sure that that little X is in front of your name, or otherwise just be real quiet, because we're about ready to get into the role play here.
Okay. I'm going to try to set the stage for you a little bit with scenario 1 of the case study. So we've met Millie, we've thought about her a bit. Now we're meeting her in the hospital setting 6 weeks after her monologue. And objectives for this scenario were for the learners to conduct a head-to-toe assessment, use appropriate evidence-based tools, and we would give the student a list of hints about where they could find these evidence-based tools. The student will be able to identify critical estimate findings. They'll be able to discuss pertinent findings and relate those to those that are commonly found in the older adult. And we're also pulling in the use of SBAR communication techniques when communicating with other healthcare team members. So we're pulling in some of the safety as well. And our scenario participants today, we've got Millie Larson will be played by Elizabeth Arnold. Miller Dina will be played by Michelle and Bieber. The nurse caring for Millie is Tracy. Giving shift report will be Diane, and Diane will also serve as the nurse practitioner who receives a phone call from Millie's nurse. And with introductions, I think we'll go ahead and start the role play.
Okay. Can everyone hear me?
Sounds good.
Yep.
Okay. My dog got me off and left me here. I'm not where I am or why I'm here. I feel okay. I can't how my life has changed in the past couple of weeks now. A couple of weeks, no, months ago. I can't remember. Why can't I remember things? Things change. That's that. I've always been a strong woman. Where's Dina? I haven't seen her in 6 years. No one comes to see me.
Tracy, are you ready for me to give you a shift report? I've just finished taking care of Mrs. Larson. I'm ready to give you some information.
Okay, ready for report.
Okay, great. Well, Mrs. Larson is an 84-year-old female. She was admitted from home with confusion. Her noticed she wasn't making any sense or acting right when she came in to visit her yesterday, and she went to the emergency department last night. And they had to wait in the emergency department all last night because we didn't have any beds, and the bed just came available a couple hours ago, so she's just now being admitted. I do know that she has a history of hypertension and glaucoma. She has osteoporosis and arthritis. Her cholesterol has been elevated for some time, and she also has some stress incontinence. We're not sure when she last took her medications, and so we don't really good information on that. Labs just came back, but I haven't had a chance to look at them yet, so you probably want to take a peek at those soon. She does have medications ordered, but they just came up from the pharmacy, and we need to get those to her. She's not in any pain right now, but vital signs, which we just 5 minutes ago, her blood pressure was 180 over 110, and her pulse was 80, and her respirations are 16, and her temp is 98.4. There you have it, Tracy.
Hey, thanks.
Have a good shift.
Thank you. Hi, Ms. Larson. How are you today? I'm Tracy. I'm one of the nurses here at the hospital, and I'm going to be taking care of you today.
I'm in the hospital? Where's my daughter?
Daughter, Dina's right here next to me.
I haven't seen her in so long. Been here with you all night.
Let me get washed, and then I'll come over and we'll do a little assessment and see how you're doing this morning.
Okay.
Check your blood pressure. Is it okay if I call you Millie?
Yes, call me Millie. What's your name again?
Tracy.
Tracy.
Yeah.
I bet she's been taking her medicine.
Okay. You brought her into the ER last evening. Is that when her symptoms started?
Well, I went yesterday to check on her, and that's when I noticed that she was confused.
Her blood pressure is a little elevated. It's 180 over 110, which is what the nurse that gave me a report also said it was.
Isn't that right?
That's a little elevated, but has your mom been taking her medication while she's been at home?
I'm sure.
Okay. Millie, did you take any medicine today? Or yet?
I take so many medications.
Okay.
I can't keep them all straight.
Okay. You know, her blood pressure might be elevated because she didn't take her medication yesterday, but I have some orders for medications that we'll get to in a little bit. Millie, can I ask you a few questions?
Sure.
Okay. Do you usually make your own meals at home, or do you have somebody that helps you, or Meals on Wheels? Does somebody deliver food to you?
Well, I try to make my own meals at home. Sometimes people deliver me food, but mine always tastes better.
Oh, okay. Do you live in a single-story home, or do you live in a home that has stairs?
A single-story home.
Okay. Do you have any problems getting around the house that you've noticed?
Well, her bad, but for the most part, she can get around.
Okay. No history of any falls or any dizziness or anything like that?
No.
Okay.
I hear music.
I know.
It's somebody's answering machine. So
Did tell us something?
We'll just keep on, and if it happens again, we'll just pause because it ends in a few minutes. It's somebody's answering machine.
Okay, no problem. Millie, let me just take a look at your skin. Let me see if you have any bruises or anything.
Okay.
Okay. Dean, did your mom get any sleep last night?
She was getting eventually. She was confused because she didn't know where she was.
Okay. Does she normally sleep well, though, if she was at home? The ER is not exactly the best place to get a good night's rest.
She sleeps about 5 to 6 hours a night.
Okay. All right. And when did this all start?
Yesterday, to check on her and bring her groceries, I noticed that she was confused.
Okay, so this just started recently.
Yeah, so I took her to the emergency room.
You see her every day?
Excuse me?
You see her every day?
I see her about once a week.
Okay. All right. When was the last time you saw her before you visited yesterday?
A week ago, but I speak with her on the phone frequently.
Oh, okay. So you haven't noticed any other confusion until yesterday?
Correct.
Okay. Millie, can you do me a favor? Can you squeeze my fingers?
Squeeze them both at the same time?
Squeeze them both at the same time.
Okay.
Okay, good. You have good strong there.
I have a really bad headache. And anyone seen Snuggles lately? Where is Snuggles?
I'm sure your daughter's taking good care of Snuggles for you.
I'm taking Snuggles. I was there this morning taking care of her, giving her fresh food and water. My head really hurts.
You have a headache because your blood pressure's a little elevated.
I took my medicine, so maybe.
Okay. Well, we have orders from one of the doctors from the emergency room to get you some medicine for your blood pressure, so hopefully that will help your headache. I also want to call the nurse practitioner and talk to her about it, so we'll see if she can give you something for your headache as well.
Okay.
Ladies, have any questions for me?
Thank you.
Okay. Dina, have you noticed that your mom has mentioned that she sees things or unexplained things are happening to her before you noticed her confusion yesterday?
No, not aware of.
And she recognizes you and your children and...
Yeah.
Okay. All right. Let me go call the nurse practitioner and see what I do about your headache, if you don't have any other questions.
Thank you.
I'll be back. Okay. You, Diane.
Yeah, okay.
Ring.
Yes, hello. This is Diane.
Hi, Diane. This is Tracy from Robert Wood Johnson. I'm calling in regards to Millie Larson. She's a new admit from the ER from last evening.
Yeah.
And I'm calling because her blood pressure is extremely elevated. It's 180 over 110. I do have orders for blood pressure medications, but I also was very concerned that her daughter brought her in because she has acute onset confusion. And her daughter's very anxious to find out what's wrong with her mom. So I wanted to see if you'd be able to come up and check on her.
Yes, sounds like I should come up in just a few minutes, but I would love for her to have some of her blood pressure medicine. Do you know what she's taking, or do you have hers there? Can you tell me what they've ordered for her, or if anything?
Yeah, they Captopril 25 grams POTID and the Metoprolol XL 100 milligrams daily.
Okay, and do you have any sense when she took them last?
No, she doesn't remember if she took any medicine at all, so I'm going to venture to guess that it's probably been a while since her blood pressure is 180 over 110.
Okay, and nurses haven't given her any of these meds either, right?
No, just came on shift and I got report and the meds just came up from the pharmacy just a few minutes ago, so I wanted to call you before I gave the meds just to touch base and see if you could come over and talk to the daughter.
Okay. Well, it's going to be a chance before I can get there, but I will come as quickly as I can. But I think in the meantime, why don't you go ahead and give her the Captopril and the Metoprolol. Yeah, so those two blood pressure medications.
I'll give her those, and I'll let her know you're on your way up.
Yeah, and can you have the chart ready for me, too? Because I think there's probably some other things that might be going on here, too. But I'll see you in a few minutes.
Okay, no problem.
Okay.
All right. That ended the role play. That was the end of the simulation with the learner contacting the nurse practitioner to report the elevated blood pressure. Hopefully you all kind of noticed that Tracy was using some pretty specific questions to try to find out information that she needed from Millie, and that she was using a couple of geriatric assessment tools, one being the Fulmer SPICES, SPICES, and the confusion assessment method called the CAM assessment. Thank you, everybody. You did a wonderful job.
That was good. Thanks.
Thank you.
Thank you.
And then with our learners, immediately following the simulation experience, we want to bring them in for debriefing because there have been multiple studies that have shown that it's during the debriefing where a lot of learning takes place. So we want to emphasize that you don't want to skimp on your debriefing time, and generally it's about as long as your simulation scenario lasts. So the simulation generally would be about 20 minutes or so, so you make sure you leave about 20 minutes for debriefing. Another point is if you're actually in a simulation lab, you would hopefully be able to go to a classroom or a conference room nearby to get the students away from the situation to be able to really think about it and reflect. The facilitator needs to be non-judgmental because we want them to learn. We don't want them to feel like, oh, if I say something or I've done something wrong, we don't want it to be punitive in any way. Nor do we want the facilitator to lecture to the students. That debriefing would not be the time to teach the students about how to assess for confusion and go on about that sort of thing. Hopefully, we would let the students come up with that. And then having a pre-written set of questions for you to use, and generally they would be open-ended questions, can be extremely helpful to guide the discussion. And if you're running the simulation for several different groups, you want to make sure that you have some consistency. To the debriefing or guided reflection questions that were developed for this scenario, there are 12 of them, so we probably won't get through all of them, but we will at least get through the first few. So the first thing that I have to ask participants is, how did you feel throughout the simulation experience? You want to go ahead and respond, please?
So, or Michelle or Elizabeth, you know,
how did you feel? Think from a learner perspective. How would the learner feel throughout?
Yeah.
Were you nervous? Yeah. And see, and this situation is probably relatively a piece of cake, as they say. So the first semester student, yeah, that's a common thing for people to say that they felt nervous.
I anticipate what's going to come next. So you just prepare and anticipate what you might say.
Agree with that.
Because you're sure if you were the student, you know, what is going to happen next?
Right. So, yeah.
Absolutely.
What are they going to ask me, and do I know the answer?
Mhm.
We've always given our students a list of objectives for the simulation beforehand. So I was asked, which objectives were you able to achieve from the list that we had at the beginning of the scenario? Okay. Did you feel like you could conduct a head-to-toe assessment? Did you feel okay with that?
Oh, yeah. I mean, if everybody wasn't using their imagination, it would have been great.
Right? So objectives were using evidence-based tools. Were you able to use the SPICEs and the CAM?
Yes, absolutely. I wasn't actually, I told Diane earlier, I wasn't as familiar with those tools.
Mm-hmm.
I looked them over prior to, doing the presentation, and I found them very helpful, actually.
Mhm.
That's great. Those tools are from the Hartford Foundation website, consultjerryn.org, and our grant was through Hartford, so we used that website to find and reference different evidence-based tools. So good. Glad you found it helpful. Able to identify critical assessment findings?
Yep. Okay. The SPICE is very easy to utilize, and the CAMs, I think if you're familiar with method for the instrument, then you can follow along with that. You just have to be familiar with it.
Right. Student would need to do a little homework, maybe.
They like I did. Yes, I would definitely say that if they weren't familiar with them or taught prior to the simulation, they would have to look that information over to understand. And
that would be something that the instructor would plan. Would that be something, A, covered in lecture, specifically, or B, would you just have the students in their preparation for the simulation have access to the website and kind of point them in that direction and let them work on their own?
Right, yeah.
Okay. And then SBAR, you did a wonderful job with SBAR. Do you feel comfortable communicating with the nurse practitioner?
Mhm. Yep.
Were there objectives that the group felt we weren't able to achieve, if there were any? Actually, you all did so wonderful. I don't think there are anything that we didn't achieve. I could see a beginning student stumbling through the use of some of those newer assessment tools personally.
Yeah, absolutely. Especially the SBAR. I would think that they would, if you've recalled the physician or an NP to speak to, that would definitely be something they'd be apprehensive about, even in a play.
Right.
Yeah. So great that it's used in role play in school, though, because it's a technique we use in hospitals as SBAR. So get used to that and getting comfortable with that kind of of your conversation is a great thing.
Absolutely, because we know that students very infrequently, if ever, have the opportunity to call a healthcare provider while they're a student, and they're expected to be proficient at it as soon as they graduate.
Yeah, so this gives them a lot of organization, and I think it's great.
Did you have the knowledge and skills to meet the objectives for the scenario?
So
this is where the student would identify weak points and, how could we have done better, for a future patient encounter of this type. And I move on to the next slide here. In the interest of time, I don't think we can go through all of these. You can pull in what did the team feel was the primary nursing diagnosis. So if that's something you're focusing on, you can have them develop a nursing diagnosis for Millie. Question 10, were Millie's symptoms what you expected, or were her symptoms different from what you would expect? Did you have any thoughts on that at all? I mean, what we were to pull in here, and I don't know if it was highlighted enough because we didn't see the chart soon enough, I didn't put the charts up soon enough, was your analysis was off. Did you notice that from the labs?
Mhm.
I didn't address it. We didn't get to that part only because it wasn't there.
Right. And
it looked like we were looking it up as we're going along.
That probably needed to be there a little bit earlier. Maybe even right after the shift report, it would have been helpful to have that, because it looks Millie has a UTI, and her presenting symptom was confusion, which was an atypical presentation that the older adult has with UTI.
Right.
And then finishing up, is there anything else that the group would like to discuss? We'd kind of open up if there's any questions or anything that just want to make sure that all the participants have had a chance to say anything that they would like to say. And generally in a role play of this type, we would have had a couple of different roles added, such as we usually have a primary nurse and maybe a nurse assistant or a nurse in orientation to get a couple of different people involved so that we can actually get more students involved in the role play. So, all right, debriefing. Great job, everybody. That went very well. Went very, very well. I want to point out the other scenarios that go along with the unfolding case. So we had the first one was in the afternoon after Millie had just been recently admitted to the hospital room. Scenario 2 is the next morning she almost fell over her IV pump. Her confusion's getting a bit better, so the focus of that scenario is safety and fall risk. And as we all know, patients with a UTI don't stay in the hospital very long. So the next day, they already want to send her home because her confusion's cleared. But Dina wants Millie to come home and spend some time there to recuperate. Millie is adamant to go home. So then there's that family conflict there that gets dealt with during that scenario. We also pull in some the social worker and people like that, as well as a nutritionist, and then medication teaching plan needs to be completed or developed. So that could be a big component of that unfolding case. Two big components. One would be, which other disciplines or healthcare team members would be appropriate to pull in this situation, and then secondly, how do you develop a teaching plan for someone like Millie, her age, with her level of understanding? How do you develop one? How do you make sure that she understands her medications? Because a lot of you, in the beginning, when we were talking about what are our concerns about Millie, her understanding of her medications came out a couple of times. And this piece of the unfolding case study is finish the story. So the story works is you can either do this after each scenario or after the students have completed the entire unfolding case. And how we would use this would be you would tell the students, you have seen Millie at 2 or 3 different points in time. What do you think the next point looks like 3 months later? So have them structure their response by describing how the situation further unfolds and why, based on what you know about her history, her risk factors, and your skills and attitudes to reflect 3 months into the future with a focus on where you might see her functional status, and then we'd like to include 1 community service referral. And also think about what is the nurse's role in Millie's continued care 3 months down the line. Students can do this in a 2-page paper. They can make a journal entry. Want to focus on incorporating local community resources. They would have to think about what's available in the area. And as a group assignment, and again, could be done as role play. When we present these unfolding cases for pilot, we sent them out to different schools, and they were using these. We got such positive feedback on this finish the story piece. But the piece of feedback was the students did not want to do a 2-page paper. They had written enough in their life as a nursing student. They greatly preferred role play or group assignment, and we even had some instructors report one student wrote a poem, what Millie would be like 3 months later. Another student wrote a song. So, sky's the limit with the finish the story piece. So actually, to model this, if you would make a few notes about how you think Millie might look 3 months from the time that we met her and took care of her in the hospital, we'll call on to share your ending to the story. So I think what we're going to do is just give you a couple minutes to think about it. We'll play some music here for a few minutes, and then we'll come back on and see what your ideas are.
But sounds like it's a good place to end. I'm waiting for a final chord here from the music.
Yeah.
Hate to end these songs in midair, but anyway, okay. So Sarah?
Yes, I'm here. Does anybody have finished the story idea they'd like to share?
And we'll give you a call. Okay, Laura. So *6 to unmute and give us an ending here.
Hi, how are you?
Good.
You can hear me? Okay, I said that before Millie left the hospital, a social worker intervened and assisted her with getting her further medication reimbursement programs and Meals on Wheels.
Mm-hmm.
And, Millie is better able to understand her schedule and her rationale for taking them, her medications, and will take her own blood pressure as well as low blood pressure in like a journal. She also has fall alert system in her home, and her family visits more frequently.
So home with a fall alert system.
Because she's so adamant about being independent, and that was so important to her.
Good. I bet you felt that was important to follow that through.
Yeah. And that's but that's pretty much what I came up in the time.
Okay, that's great. Thanks.
Yeah. Thanks, Laura. And Christine Brewer has raised her hand, and I think, Christine, you're with a group there. So *6 to unmute. Go ahead. So we're calling Christine Brewer, and you need to do the *6.
Hi, Dan. Can you hear me?
Yeah, absolutely.
Hi, this is Grace Carmoon. I'm with the Fairleigh Dickinson group. The ending that we came up with was that she got to go home, but she found a nursing student from her parish to check on her Monday through Friday for about an hour, just to make sure that she was eating and taking her medicine.
That's a great idea.
Yeah. Takes care, integrates the community resources.
Right, in her church.
Yeah. Nice. Well, thank you. Anybody else, while we have the FDU folks online, anything else you want to say there? Otherwise, I'm going to go on to Dr. Louie.
That's it for us. Thank you.
Okay. Thanks. So, Kim, calling on you, and go ahead and do the *6 to get unmuted.
This is Claire Donahue for Kim Louie and the William Patterson University Consortium. She and Ruta are here with us. Great. And we thought that she invited another widow from her parish to come live with her to be able to fulfill her goal of staying home, provide some companionship, some financial support, and enable her to stay independent. We felt that her daughter was limited in the support that was given. We don't have any information about her husband, so we're not sure whether she's a single parent and with 3 children, one of whom is giving her a hard time. We felt that she needed to explore other social supports in order to stay independent.
That's a great point.
Yeah. Well, thanks for sharing. And Karen Horry and
hello.
Member, yes, hi.
This is Nancy Flood. I'm with Karen.
Okay.
The discharge planner should refer the patient for visiting nurse services. She can have a home health aide come to her house for 2 hours a day to make sure that she's safe and that she can, perform acts of daily living and with her meds. But Cat Snuggles will still be with her for company, hopefully. Important is that the visiting and the social worker work with the to make sure she gets more involved, because she'll have to come and fill the med boxes so that she's taking her meds properly.
Mm-hmm.
Yeah.
Yeah, that's a great idea. I think visiting nurses, home health aide, maybe a homemaker that would help with some of the housework. Someone had mentioned that they were worried whether she would be able to keep up with the housework. All great ideas. Thanks.
Okay, and Cindy, Bob has his hand up, and maybe we'll
okay.
Bob's comment, and then were you ready to move on after we hear from Bob?
That's fine.
Okay, go ahead, Bob.
Yeah, I just wanted to add that we do a further assessment, I think, with Millie. We have to evaluate closely what her community resources are going to be. We have to see what her family resources are going to be, if any. I mean, she told we don't really know enough of the house. We don't even know if she knows how to turn the heat on. So whether a visiting nurse does that or community aides do that, that's great, but I'm not quite sure where she would get those resources, because she's also said she's kind of nervous about money, and that's going to cost money. So I think whether it's family, church, social work, we need a much further assessment of her living environment.
Right. Nice to have some more information, but part of the finish the story is for the student to kind of think in their head, well, how did it unfold? What did we find out? Did we found out, yes, she can't turn on her heat in the winter, so she does need to have someone contacted to come and take care of that for her, and she does that 3 months later. So, yes, we need more assessment, but then we kind of want the student to make that stretch to think, yeah, I've got that information, and in my community, these are the resources available, and these are the ones that would be appropriate based on where we're at 3 months down the road. Yeah, that's a good point, because there's a lot of missing information here. Okay. Thanks, Bob. We'll go ahead and move with our discussion to talk about how to develop an unfolding case study on your own. We do have unfolding cases, so Millie is available for you to use online, and I've got the website later on in the presentation, I believe. But Millie's scenario, and then there will be 3 other unfolding case studies that will be on the NLN website at the end of March that you'll be able to access as well, because developing cases, simulation, and role play, we know is a very time-consuming activity. It's a necessary activity, but it's real easy to underestimate the amount of time that it takes to put a scenario together. You can't just slap it together and hope that it's going to work. And you really want to have a quality experience for your students, especially if you're pulling them into role play. You want that to be a good experience so that they're willing to continue on using role play. And it all comes down to level of preparation that has been made prior to really implementing the case study. The first thing here is consider your objectives, just like we would any time. What's expected of the learners? What are we going to be focusing on for the unfolding case? Where will it be used in the curriculum? Is it one used early on, or is it used in the curriculum as with the senior level students getting ready to graduate, and you're expecting them to handle more complex issues? What kind of standards or competencies will be highlighted? Used a template for all of the scenarios that are in the unfolding cases, and the website is here, listed for you at nln.org to access Millie, and also you can download a blank template of charge from the NLN website. And you can also feel free to make your own template. That's just an example of one that can be used. But it's really helpful for you as a developer of a case study to make sure that you don't forget any major pieces. It causes you to think through what equipment will be necessary for the role play or the simulation so that it helps you really be more organized. And another thing that a template helps you to do is someone else can use your template that you've developed. You can share that with others, and they can implement your scenarios as well. If you figured out your objectives, then I think the best thing to do is just brainstorm ideas. And it usually looks better if you can have a group of people, if you do team teaching or have some other colleagues that you could pull in to brainstorm ideas for patient situations you see in real life that will meet those objectives, because the ones that are going to have the most meaning for students are ones that they see as being real patient scenarios that they'll find. And then depending on the level of the student, do you want to focus on something common, such as a UTI with a beginning student, or do you want to focus on a rare clinical issue, such as DIC or something way out there? You need to think of a time frame. How long do you want this unfolding case study to, what's the time frame for the unfolding case study? Is it a day? Is it a semester? And then last point here, don't make your case too complicated to be implemented, because you can't throw everything in to one unfolding case. That's why we have several to meet the objectives of our framework that we use. Because you really want to make it, you don't make it too easy, but then you don't want to make it too complicated to where there's no way your learners can do what you want them to do within a reasonable time frame. And then after you've brainstormed and had some ideas, and the way we brainstormed when we developed these unfolding cases was we had an easel and we had a recorder, somebody just writing ideas, and then we stuck the pages around on the wall, picked the ones that we liked best, and went from there. So we went ahead and made the decision from what we had thought about, which clinical issues made the most sense based on what we wanted to present to the students. And we made a bit of a diagram, nothing too intricate, but it basically, how does the case flow? How many scenarios do we need in the unfolding case to really walk the student through that? Think about the fidelity of the simulation or role play. Do you want to do low fidelity like we did today? Or have you got the availability of a high fidelity simulator? Or group faculty that has used these really preferred to use standardized patients for Millie and some of the other people scenario. They're fortunate enough to have the resources to have a pool of standardized patients from which to draw. Or sometimes other faculty or other lab personnel that enjoy acting might be willing to fill in for you, because it does really help if you have limited resources to just kind of recruit. And then assign group members portions of the case. So if you've got a group of folks working together to develop the unfolding case study, everybody doesn't have to labor through the entire thing together. Make assignments and have due dates, and then come back together, put your unfolding case together. Okay. Can't highlight enough using a template so everybody's kind of on the same page to guide you through the steps, and you'll put together the work from your assigned group members. It's important to both circulate what your work has been, circulate to all group members. So if there are any corrections or additions that need to be made, you can do them at that time. One thing that we had with Millie was medications. I guess some of the medications we had selected for her to be on were not exactly what the specialist thought they should be, so we were able to get those fixed. And then finally, once you've got it all together, you need to go through as a group and review. point is pilot testing. I can't emphasize enough, use it and pilot test. Your case and your scenarios really need to be piloted before you use them, because there will be bugs in the system, things not flow exactly as you thought they would. You keep to a specific time. You don't want the unfolding case to take an hour when you really only had 15 minutes. And those sorts of things can be tweaked out during the pilot. If you can find a group of students to pilot the scenario for you, that's the best way. If not, find volunteers amongst your colleagues. But you really need to run through things because, again, you want to have a quality simulation or a quality role play because it improves the learning for your students. So once you piloted it and worked the bugs out, then you're ready to run the case. Make sure that you're conscious of the time of this scenario. Once you've piloted it, you should have a good feel for how long it should last. And in my opinion, 20 minutes, 25 minutes, half hour is maximum. Others have other opinions, but I think that's long enough. And then regardless of where they are in the scenario, 20 minutes, and scenario is over. Follow your briefing guidelines that you will have developed when you wrote the case. Get back from participants. You always get great feedback that help you to improve the case over time. And final thoughts here for you. Cases are definitely a creative way to integrate active learning into your teaching. They pull in the 7 principles of good teaching, and I know you all have heard a lot about those. And by using an unfolding case in your teaching, they're there. Learners have been very positive about the simulations and pilots that we've run. Students read it, and usually what they say is that they don't know why they didn't get more simulation or why wasn't simulation started from the beginning of the program. And I'm sure that I hit on the point again that much of the learning takes place during the debriefing and the reflection time that occurs shortly after the scenario. And then if you come up with a good scenario, be willing to share, because it does take a lot of blood, sweat, and tears to get one of these up and running and in good shape. And the more we can share amongst each other, the easier it will be for all of us. And time that you put into the development of the case is worth it. We've had wonderful experiences with these cases. Like I had said with the Finish the Story, the student that wrote a song for Millie. It's just pretty amazing what the students will do with it. So if you're willing to give it a shot, I think you guys are in a good position with for collaboration with the consortium that you've got going. So I hope that you'll be willing to go out there and try one of these for yourself. So questions, comments?
You have quite a time, so raise your hand and we'll take some comments here. Questions?
Yeah, I flew part.
Oh, well, that's great. I think probably we'll give everybody a kind of a framework, but we all know that each one of those steps is, can take some time. So what's in your mind right now about unfolding studies? Well, ask a more pointed question, because I know some of you are active in doing some work with simulations. Probably, I know I'm thinking of Bob, so I'll probably kind of directing this to him. But what see here as being differences in the unfolding case study and what you're doing with your high fidelity simulations, and probably we'd just love to hear a little bit more about what you're doing there at Rutgers and in terms of, any of this work with simulations. So Bob is there? Yeah,
okay, I'm here now. I'm sorry, I had some trouble unmuting.
Yeah, okay.
I was just actually commenting to myself how much I enjoyed this scenario. At Rutgers, we do mostly high fidelity, use the high fidelity simulators.
Mm-hmm.
What I love about this is that the simulator would be a part of it, but I don't think it has to be the central part of it. And I never really had thought of using, an actress or an actor to kind of give the students a better picture. It's usually something that's always told to them, and we can never really give them a real idea of what's going on. And even in my own mind, it kind of generated more thought just hearing her kind of go through her little story, Millie's story. And we have been trying to, our lab courses, fundamentals courses, we've been trying to give the patient, a patient almost for the semester, and kind of have different things happen to that patient along the semester. And I'm not sure to call that an unfolding case scenario because it's mostly for, skills, testing out and stuff like that. But it definitely is very intriguing, this whole idea, and I was very glad to be a part of it.
Thank you. Yeah. And you develop your own cases there? Your own
Yeah, what we did originally, we've been doing the simulation since about 2004. What we originally did was, just before my time there, they purchased a set of, clinical case scenarios, or SCEs, as they would say, and they really focused on acute problems, whether it be, code blue or heart attack or, acute asthma attack. What we had to do was sort of use the idea for the patients, but break it down so that we have differing levels of fidelities, and kind of that was our starting point. So now what we try to do is in each of our clinical courses, try to incorporate some kind of simulation, whether it's an acute case or a chronic case. But I think whatever you end up doing with the simulator, you always have to develop stuff. And I also like the point about making you stick to the time. A lot of times faculty won't do that, and and the students what objectives they have achieved. That's kind of something that we don't do. I like that a lot too.
Great. And you kind of bring up a point that I'd emphasize is there are places where you can go to obtain already developed cases, either unfolding cases, from low fidelity all the way to the high fidelity. And some of them you can purchase. I know there's, of them or so on, and some of them are kind of pricey, I think. But then there's some that are low cost or no cost out on the web. These ones are NLN, and certainly these could, probably be adapted a little bit further if meet local needs. And then I think on your references and resources, I gave you a few other sites where you could go, where some of these are already pretty well started for you. So if they match your content and your objectives, of course, that's always your starting point. But in some way, you don't always have to reinvent the wheel. So if you can locate things that are already developed, then that certainly makes life easier. So thank you for that. Elizabeth, Elizabeth Arnold, your hand is raised. Do you want to make a comment? Okay, good.
I did. I just want to say that I think this topic is so interesting and it's so timely because myself and Andrea Taylor, another scholar, we're in the middle of doing an evidence-based project, and we're looking at simulations like online case studies to high-fidelity simulations using how they affect confidence levels of nursing students. And so I think the topic is very interesting, and I'm excited to be a part of it. So.
That's good. Okay. And Elizabeth, go find the whole Journal of Nursing Education that's out just this month. I think it's probably the February issue.
Okay.
Get your hands on it because there's, if your evidence-based is about teaching practices, but anyway, there's a whole bunch of scientific articles about simulations and some of the things you were just talking about. So check that out. Yeah.
I will do that.
Okay. Comments or questions? Cindy, is there anything else that you want to say to us, emphasize, or anything?
I just want to emphasize, or I guess offer, if you have any questions for me later on, you can feel free to contact me, because as I said before, we're kind of all trying to work together to get these types of cases and simulations going for our students, and it's time-consuming to get them developed. So most people in the simulation community are very willing to share. So I'd like to hear from you if you end up using any of our unfolding case studies, and I'd be willing to share any that I had as well.
Thank you for that nice offer, and thank you for this fabulous set. And it all went, just did expectations. And I guess one thing that we've learned is that we can do unfolding case studies as a webinar.
Yeah.
So I know I had to, we're taking deep breaths here where we're going to be able to
are.
But I will, from my perspective, I think it was a success, and I hope we got a little more interaction going, and certainly we've had some good discussion, and in some ways love for people, we experienced it, but then to step back and kind of reflect how does this play out? How much learning did we have? I mean, I thought that there was an incredible amount of learning from that Finish the Story activity, because people had to bring in a lot of content, and the power of that really showed to me here. So this was great. So if people are thinking of last questions, go ahead and be ready to ask. In the meantime, Cindy, I'll have you push the next couple of slides, and I'll do my marketing information, and then we'll see where we're going to go from there.
Okay.
Usually we have a follow-up activity, Cindy, for sessions, and here is that they should go ahead and try to do some development of case studies, and I'll ask who's going to stay on here with me or whatever else we want to do next with that. And to remind everybody that the next CLC session is in March, and the first one is going to be from 1 to 2:30, and this is going to be for the scholars in cohort 1. Our graduating scholars, it's hard to believe it's already time for graduation, but we'll talk a little bit about transitions to a faculty role, kind of getting you, prepared and launched and ready to go. So we'll get that information out of, the week of the session, and that's March 11th. And then in the afternoon, we'll do from 3 to 4 with a career builder, and this time we're talking about how to write for publication. And I'm going to same thing like I did with the grants. This is something that's an expectation, and I'll give you some tips. And that's targeted for everybody, but anybody can come to either of these. So that's my story. So let's see if we have any last questions here. And let's see if we have one more slide there, I think. Cindy, while we're wrapping up here, I want to thank you again. You did a fabulous job. And Christine, Elizabeth, and Michelle, were wonderful. Tanya does a great job of keeping us all organized. And Gerald, thanks for queuing up our music and our audio. That all worked really nicely, too. It's great to have you on board with us. So any final thoughts or questions? And then I want to find out who's going to be staying on. We'll take a little break, but if people are going to stay on, I'll be glad to be with you guys. So any last words or comments?
Oh, it's like Mary Ann. We've got one.
Okay. Mary Ann, go ahead. Yeah.
I guess foreign voice comes in and says you're no longer I wanted to tell you, I'm reminiscing as I'm listening to this, and remember in the early 1980s, we used case studies, but they were on, they were paper and pencil, and most of the faculty went to hospitals, and we got real patients, and, but there were actors or anything. It was just, we kind of walked through the whole scenario, and never in my imagination, or any of us, did we think of doing it this way. And then it seems we went into just straight lecture, and I'm so delighted to see this come back, but it's so much richer. So thank you for the insight.
I agree with you, Mary Ann. Once you see it, with the students in the classroom, how much more engaged the students are, how much richer the learning is, how those 7 principles of good education are activated. And Cindy, you made it you feel real and exciting to us too with your experiences. So
thank you. I appreciate that.
And thank you very much. I appreciated it. I can make sure I will tell our faculty back at Seton Hall.
Yeah.
Our scholars are not here today, if you all notice, but they'll be around next time.
Yeah, they're Cindy. They're at the AACN Family Development Conference. They're someplace warm. We'll get
they're
them,
in Texas.
Well, their memories of their experiences down there, we'll get those captured back into the CLC.
I know they will be sorry they missed this, because I know 2 of them in particular have been doing scenario simulation, and one is going to be working this semester too. So, but okay, I'll tell them.
Yeah, well, we'll have the archive. They can listen.
Yes.
So, yeah. Okay.
Yeah.
So
thank you again. I'll unmute myself. I'll mute myself. Thank
okay.
you.
Thanks, and then Lucille. So Laura, unmute yourself, *6, and
Dr. Belland. I have a question about the unfolding case study in terms of the benefits, in terms of the participants' roles that they play. Does it have the same benefit of learning for each of the participants, whether they choose to be an observer or the nurse, especially when they're using the assessment tools?
Well, in the simulation research that's been done so far, there hasn't been anything done specifically on these case studies, but in a general population of students that have participated in simulation, it was found to be no difference. The students didn't report any difference in their learning, whether they were an observer or whether they were a participant.
And the reason I ask is because there's such a time limitation in class. I was wondering if you should take the time to rotate everyone around the different roles, or if the learning benefit was the same.
Well, the studies show right now that the learning should be the same. However, I'm still a firm believer in rotating it around if you can, if it's possible.
Thank you. Okay, thanks.
Okay. And one thing I would just say, you saw how we try to role model engaging everybody, because we had everybody except for the role players, in fact, were observers, and they had to participate in the discussion. They had to do the debriefing, and they had to do the finish the story activity.
Right,
so in some ways, everybody does have an active learning and collaborative learning. So we do get that.
Okay, thank you.
Okay. Joel, Lucille, *6 to unmute.
You can hear me now?
Yes, we can hear you.
Okay. I'm not sure we had a push at this point. I was just thinking back to some years ago, the Macy Foundation funded a very large project in the use of actors for unfolding case studies. And it was based at Cornell in New York and used with some of their nurse practitioner students and their medical students. I had the opportunity to participate in that, and that for me was a real high. I wonder if there would be an opportunity to use actors more, because with the human variable, You know how things are going to go, and I think that's the realness of nursing. For instance, with Millie, think to ask how much control and how much intrusion into her own life she would be willing to tolerate. That was my first thought. You know, we talk about assessing her confusion and that she's incontinent. Well, what will she tolerate? I always start there with any patient, and with the actors, that was very nice, the predictability. One more point. I haven't got the website on me right now, but there's a website up in Upper New York State, one of the state colleges, that is full of many case studies for natural and behavioral sciences. I've used some of them. It gives you the core. It enables you to start, and you can build in the nursing scenario around it. So, I'll go home and look for it all, look on my computer here and see if it's here. And if we find stuff like that, where do we put it so there can be general access?
So why don't you send it to me? This is Diane, and we'll put it in the WebEx discussion forum for everybody to retrieve. And I want to do a little newsletter because there's a lot of odds and ends of things that need to everybody share around. So I'll try to in an email too, so we have it in our face.
Okay, very good.
Okay, thanks. And Beth, your hand up, so go ahead.
I just had a question for Dr. Reese regarding her tool, or a tool. During learning, I was learning about if you had anything that measures confidence, and that the observers know that their confidence level matches as much as they learned.
Okay. Yes, we. Freeze has an instrument that measures student self-confidence as a result of participation in a simulation. Have you seen those instruments that were developed by that Annaline group?
I have seen that, but I was just seeing if maybe if there was something, different. I know Pam Jeffries is,
Right.
Scotch, but my question kind of circles around. Somebody had brought up the observers, and we do the same thing. We use the observers and we cycle through. I was wondering about their confidence to care for that particular patient from a critical thinking and a psychomotor standpoint.
Well, from a psychomotor standpoint, I don't know of anything that has been done to look at that piece of it. I participated in some studies where they did a cognitive test of the material that was presented in the simulation before and after participation. There was really no difference. There's no difference in cognitive learning, actually, which was somewhat unexpected, but there was no difference either between those that observed and those that were participants in the study. I'm trying to think if I can think of anything else.
Oh, that's helpful. Thank you very much. It's kind of, I think there'll be a lot of more stuff coming down the pipe.
And it's just hard. Our research in simulation is in its infancy.
Right.
And Bob, I recommend that.
Thank you very much.
You're welcome.
Your nursing education to you too, because I know some of these studies, confidence was one of the outcome measures. So yeah, it's chock full of good stuff. You get your hand on the whole issue.
Thanks, Diane.
So, yeah, okay. And Catherine Manetti, how are you doing? We'd love to hear from you. So next to unmute.
Everyone, and hi, Dr. Billings. I am particularly interested in the idea of bringing the simulator into the lecture hall, into the classroom, and barring the feasibility of that and considering time constraints, I think that I wonder if it would be a good idea to videotape simulations as they are occurring, so they can be archived for future use, both simulation laboratory and in the classroom.
Oh, absolutely, absolutely. I understand what you're saying about all logistics of getting the simulator moved into the classroom, and of course it's going to depend on your particular environment, the number of students and things like that. Our sim lab is right down the hall from the classroom, and we have some classes that are very small, so we're able to do that. But we also do not have good video capabilities where I'm at the current time, but we're working on that. I would love to be able to have students in the lab so that don't feel like they're in front of the whole classroom doing the simulation, and then have it real time into the classroom, and then the participants in the simulation and all the observers that were in the classroom could do the debriefing piece together.
And I'm also thinking of the clinical scenario because, for example, in psych mental health nursing, if you had some, videos available from work that has previously been done, they could be downloaded onto, let's say, the instructor's laptop or one of the students' laptop, and then they could view that way. So that would be a good use of post-conference time or seminar time. If the wheel has already been invented, then, why reinvent it? You know what I'm saying?
Absolutely.
It's a lot of
that
creativity.
Sounds like a great idea.
So I think if that can be done on an ongoing basis, it would behoove, everyone for future education.
Great idea, and some further direction for additional research and some classroom testing of all of this. So great idea, Catherine.
Thank you.
Okay, other questions or comments here as we wrap up? And Cindy, if you see that little column up there by the participants where it says feedback, see those?
Yes, I do. Okay.
See the smiling faces? Scroll down.
Thanks. I appreciate
for you.
That.
Those are for you. We have some happy scholars. Other comments or questions, particularly for Cindy, and thanks again, Cindy, for making yourself available for further dialogue. And again, thanks to Tracy and Elizabeth and Michelle. You guys put yourself in, and it was really great. I'm grateful to you. So let me ask who's staying online, and if you're not staying, I guess we can call this a successful webinar. Is anybody going to stay on to do a little work with developing, drafting out? You won't get it done, but drafting it out or wanting further discussion about how to do the developing a case, an unfolding case study. So if it's going to stay on, let me know so whether I should blow off or not. I know some of you are in your groups together, so I will hope that you then have a little further discussion and see where you might want to be going with this. And while you're deciding whether you're going to let me know you're going to stay on, I will say to everybody, we're going to talk about simulations again when we're at New Jersey, and they're opening their lab for us. And we're going to do another one with a high fidelity simulation. So hopefully everybody will leave by the end of the semester, and we've got a good sense of the unfold case studies and simulations as a teaching and learning tool. We're ready to sign off, and one last call here to be sure that I need not be here. Does anybody want to stay on and discuss anything further? Raise your hand or let me know, or email me, whatever.
Hello, Ann?
Yes.
It's Pat Nicky.
Pat, how are you?
I'm good. How are you?
I'm good.
So in our group here, while we're muted, we've been talking about the case studies a bit, and
Yeah.
I think what we would like to do is to develop one, but have time to do it and work on our seminar as something to put. Does that?
Oh, great. Yeah, and if you want to get on a phone conference with me, or I won't volunteer, Cindy, but I'd be glad to, have you, look at it for you and then talk with you if you want to
Sure.
do something like that, or just send it and give some feedback.
Okay. That's what, we'd like to work on it offline a little bit.
Yeah,
and
I think that makes good sense.
Process all of this and go online to where the templates are and put it together that way.
Sounds perfect.
Okay.
Thanks for letting me know.
You're welcome.
Okay, thanks everybody. Thanks Cindy. Thanks scholars. Betty. Gerald. Okay, I'm signing off. Bye bye.
Thank you very much. Bye bye.